Hello, I'm Robin Brumble, and I am the Director of Scientific Affairs and Research here at CLL Society. We are entering into the third year since the start of our research program, for which in just 3 short years, we have already committed to funding $850,000 solely towards CLL and SLL research. And today I am particularly excited because we are joined by our 2024 Integrative Medicine Award recipient, Dr. Christopher Jensen. And we are so excited about this award. It is the first of its kind for CLL Society, and we hope to see even more research on integrative medicine approaches in CLL in the future. So we are very extremely thankful to the many donors in our community who made this award possible, and especially grateful to Vigyang Singhal and the Sim Einstein Research Foundation, who were instrumental in providing matching funds towards this particular research grant. The 2024 Integrative Medicine Award in CLL is aimed towards early exploration of research ideas that incorporate an integrative approach to addressing the many health challenges of those living with the disease. And the goal of this funding is to build a strong evidence base to improve the quality of life for those living with CLL and SLL. So, Dr. Jensen, at this time, I would like to first start off by saying congratulations. And if you could, please tell us a little about yourself, and I would love to hear about how you got to this point in your career.
Yeah, absolutely. Well, I'm very excited to be here today and very fortunate to receive this funding to support our ongoing work, improving the quality of life for folks living with CLL, SLL. I'm one of the lymphoma and CLL faculty at the University of North Carolina. It's also where I completed both my medical school training and then my hematology and oncology fellowship. Between those 2 points, I did general internal medicine training at the Hospital University of Pennsylvania, which is where I sort of first became interested in pursuing a career focused on CLL and other indolent lymphomas, doing research there under the mentorship of Anthony Nato, before both he and I left to go different directions in our career, before he went up to Sloan Kettering and I came down back to North Carolina to continue my medical training. As far as how other aspects of, getting to this point in my career, and my original interest in hematology, and oncology was driven by, I would say, my grandfather's experience with a diagnosis of acute leukemia, where he, when I was in high school, was diagnosed and treated and ultimately passed away of acute leukemia, but was really informed, or my career interest was informed by his experience and seeing his interaction with his physicians, where I went into sort of college and then medical school thereafter, thinking that I wanted to work with people with blood cancers and sort of migrated from there.
Thank you for sharing that. Your research project is called Combating Cancer-Related Fatigue, a personalized supportive care program. So first, it might be helpful to talk a little bit about cancer-related fatigue and how it differs from generalized tiredness.
Yeah, when we talk about fatigue is tricky because so many things can be potentially contributing factors, and fatigue can be driven by a lot of different sort of aspects of people's lives, other things impacting their health. But when we're talking about cancer-related fatigue, we're usually referring to sort of an either overwhelming or majorly impactful degree of tiredness or fatigue that limits people's ability to carry out the activities they want to carry out. And when I'm thinking about a distinction between sort of pathologic cancer-related fatigue versus just tiredness, I'm really thinking about this question of function and what are folks able to do and what are they not able to do. And problematic fatigue, to my mind, is something that limits people's ability to conduct activities they want to get through in their daily lives.
All right. Well, can you talk briefly about why you decided to research this particular topic?
Yeah, absolutely. So, I think it's just from interacting with my patients, something like 3/4 of my current clinical practice is people with CLL, and the most common complaint people have symptomatically is fatigue. And like I was just saying, that can be tricky. Many things can contribute to fatigue. Some of it can be related to CLL directly, and manifestations of sort of active inflammation from that. Other things that can play into it include other health issues, psychological health, sort of lifestyle. There's just so many contributing factors that it becomes, a little bit challenging for folks to tease out what is the main driver, what is contributing to their fatigue. And we're looking for other ways to help people with that. Fortunately, in the CLL space, we've had a bunch of therapeutic advances in the last several years that have allowed for disease control with fewer side effects. And for many people, treatment of their CLL results in improvement in their fatigue, but not everybody. So we're looking at opportunities to improve or try to improve the quality of life of people living with CLL by tackling their fatigue by um, other means, things other than just treating their underlying condition.
Excellent. Well, what are some of the current challenges that healthcare providers and researchers face when it comes to better understanding and treating fatigue, particularly as it's related to CLL and SLL?
I think the two big challenges that come to mind for me are the challenge I just mentioned, the sort of clinical question of, how much of someone's fatigue is related to CLL and SLL, how much of it could be related to other medical conditions, and how much of it is related to sort of other factors. I would say this comes up a lot in people that are in a surveillance stage of their CLL treatment journey, where there's a they may be watched for a period of honestly years. Some individuals after diagnosis may not have what is considered a current indication to start treatment for a period of years. They may develop increased fatigue over that time frame, and there's this running question of, am I more tired because I'm 4 years older than the time of my diagnosis, or am I more tired because my CLL has become more active in a way where we need to strongly consider starting CLL therapy or moving on to a new type of CLL therapy. So this thorny question of how much of it is related to CLL activity, and does that CLL activity constitute an indication for new treatment? I would say is the topic I spend some of the most time talking with people on a day-to-day basis in my clinic. The second challenge, I think, is just quantifying fatigue, or sort of both from a research and clinical practice standpoint, sort of wrapping our hands or minds around this question of how do we track fatigue. There's fatigue is something a lot of people deal with. How do we sort of instrumentalize or get our arms around the question of fatigue in people's daily lives, both from a research standpoint and from a clinical standpoint, so that we can know that we're moving the needle, if we're moving the needle and improving people's lives.
Well, can you talk more about what exactly you're going to be doing with the research project? Maybe like touch on some of the methodologies that you'll be using. I think that would be interesting to hear a little bit about.
Yeah, so we're pursuing a sort of multi-pronged approach, both from a research and intervention standpoint. From a research standpoint, we're combining both a qualitative approach, or what you might think of as more subjective input from people living with CLL, as well as a quantitative or maybe more traditional or sort of numbers-driven approach. And by those, I mean we have a group here at UNC who have particular expertise in turning patient stories or patient input into sort of actionable research results. Um, and I'm excited to be working with them to, at two major phases of our project, solicit input in a very organized way from people living with CLL, SLL to get a little bit more of a nuanced picture of how fatigue impacts their life, what are sort of barriers and facilitators to participating in interventions that might improve fatigue for that population. And then on the back end, getting input from them on what they have found helpful, what they have found useful, and what they think are feasible as far as tweaks to our program moving forward. So, the strong undercurrent or through current of the patient's voice or the study participant's voice in informing how we're going to be doing the research is a critical component of our program. We're going to use that information to inform and modify our treatment approach or intervention approach. So the intervention methods are subject to change as we get deeper into the program. But as far as what we plan to do initially, we're going to be finding people who are living with CLL either untreated or in a stable remission. So we're not intending to recruit folks to this research program in particular who have active indications for starting treatment, because we think the best thing for those folks is going to be getting their CLL under control. But for folks that are stably in remission or folks that are untreated, so not folks who are having a dynamic treatment change, we're going to be identifying people that have problematic degrees of fatigue as indicated by these impairments in their ability to carry out the activities they want to do, and then connecting them to some of the best resources we have available to try to tackle fatigue, which are exercise and nutrition modification or diet modification. So we're going to be taking those folks that are having problematic fatigue and are interested in pursuing some interventions for it and connecting them with Dr. Sasha Knowlton, head of our cancer rehab program, who's a physiatrist by training or a physical medicine doctor who focuses solely on treatment of people with cancer or undergoing cancer treatment, to undergo a comprehensive evaluation of their physical activity limitations, and then coming up with an exercise prescription for people, as well as connecting them with some of our oncology specialist dietitians, folks that are registered dietitians who focus solely on the care of patients with cancer, and trying to sort of go through a dietary inventory and looking for opportunities for potential dietary modifications in ways that could potentially help with energy.
Excellent, thank you. Well, Dr. Jensen, on behalf of CLL Society, I'd like to again thank you and your colleagues for the work that you are doing to advance the field in this very important area of research. Integrative medicine for those living with the disease is truly an unmet need, and we're super excited that this type of work is being done. And frankly, and not enough research dollars are being put towards understanding how integrative medicine can affect CLL. So we're really looking at, we would love to do more research like this in the future. So I know that CLL Society and those in the community are very eager to learn about your future findings, and we're excited about your work. And I would just like to thank you very much for your time today.
Thank you very much. I'm just so appreciative to the CLL Society and to the donors who have made this possible. We're excited to be building out our CLL program at UNC. We fortunately had Dr. Debbie Stevens join us from the University of Utah, who's primarily focused on building out and expanding our sort of pharmaceutical clinical trial program, though she has a strong interest in supportive care research as well. But her presence here has allowed me to sort of take the lead on some of these integrative medicine approaches, so that we can build out a research program that looks to sort of improve the quality of life and lived experience of folks with CLL, either by treating their underlying CLL or by using these other techniques to try to build them up.
Wonderful. Well, thank you for your time today. We appreciate it.
Thank you.